thank you. What a fascinating paper. I learnt so much and in a really interesting and scholarly way with some very interesting methods there, especially using visual sources. I can see that that's a very interesting way of piecing together some of the gaps that I think can appear when you're just focusing on text. So it looks like you're doing that really well, but also I think using micro-history to ask questions that, you know, all historians of the 19th century and 20th century need to be asking about the relationship between government and its populations. So, you know, big questions with a micro-historical approach. So I think we're doing that really well. So thanks, Anne. And now I'll throw it open to questions.
And I was really taken with that poor old cop that was outside copying abuse from the girls inside the asylum. So I've got two questions that come from that. One, when he wrote for instructions from the authorities in Sydney, presumably some answer coming back, I'd love to know what the answer was. And the second question is, if you were talking about asylum policy today, you'd be talking about community-based policing and social work practice, and James Fletcher doing work with self-harm and eating disorders and all this sort of stuff. So at some point there must have been a transition of this idea of government care of an asylum imposed virtually on the community through imperial authorities to the local, that other part of government, the police, developing a community-based model and starting to work with authorities in the asylum. So at what point, or do you look at this?
No, see, I don't look at that because it's such an eclectic thesis. I haven't been able to get to. I probably could have made a whole thesis out of just one of the chapters. I don't go into that, but I would assume because the structures were there early of having even the institutions for the intellectually disabled, and which is different to most other places, with that government structure and support, I can only imagine that it would have come about again through a crisis of some type. So maybe after the Richmond report in the 1980s, that there's been that leadership role, that there's been a lot more focus on policing and liaising, having like mental health liaise workers in their teams, for that sort of support. So I can only imagine it would have come out of a crisis of that. These other government departments were just saying, well, you close down these institutions, there's all these people in the community, are we really supporting them, or who's supporting them? Or so they're, you know, my opinion is that there's not the support in the community for a lot of people with mental illness. So again, that's got to be taken up, that flat's got to be taken up somewhere, and I guess it's those other government departments that absorb a lot of those problems.
Yes, I've got three things to say. One to comment on the natural area, and you said it probably comes out of some crisis. I work at children's homes, orphanages, and the people that knew me. And there's great changes, been great changes in their uses, like particularly, one myself and one of the forgotten Dalwood Children's Home that I was in. It started off as a private home. The person who owned it, who built it, was Professor Gurney from Sydney University. He was a man of letters and Professor of mathematics, and he failed to publish and got kicked out. And he went back to England, and then he sold it on to a philanthropist and a newspaper magnate, Dalwood, who bought it for his wife, and she said, it's a private home. She said, I won't live there. So he gave it to the Food for Babies Fund, and it became that was seconded out then to Manly Hospital, and they used it as a rest home for mothers and babies. Then because there were, and this happens a lot in the history of children's homes, and I imagine, because I've been a psych RMD, as SRM to that in Melbourne Life, and I'll talk to you about that. But with these types of hospitals, when government changes, or when even on the local level, like local council, and the different types of people get into it, it depends on the number of people in those those particular government
that are supporting those sort of
that support different focuses on different things. Like in Geelong, the children's home in Geelong, the first one in Geelong was built there with gold rushes, because the fathers went off to the gold rushes. and the mothers couldn't support their children, or fathers died or didn't come back or whatever, and the kids were running wild all over the street. So the men of the community, the pillars of society who belong to the church, said, look, we've got to do something about these children. That's the sort of thing that happens. So they built the home, and it changes. Every time there's a change in local government or in government, the people in the government, whatever their thing is, and whatever they see the public need is, then they swing around and they use it for a different purpose. And a lot of these places are accidental or intermittent.
Yeah, there was obviously a need for this because there was the asylums in Sydney were just totally overcrowded.
That's, yes.
The government use of existing infrastructure is really interesting, and I think that's something that we can look at today as well, that there's a lot of waste in government infrastructure and buildings in Ireland. At the time that this was proposed, there was Manning, who was the inspector of the insane and had a good relationship with Parks. Parks was really instrumental in having the girls' institution open, so I think there was a lot of people probably able to network and on the same page. A lot of inquiries. The government actually sent there were two separate inquiries. There was one done by Tucker and one by Manning, and they travelled worldwide and visited hundreds of asylums. So they gathered a lot of information and brought it back. They brought back and used some of the policies, but they adapted it to what was going to suit under these urgent circumstances, and it fit the boats at the time. And it has survived. Like, it's survived as a mental health facility.
I might take another question, sorry, and we can maybe follow up over the tea if you don't mind. Yeah.
And the girls were moved to Sydney at some stage, I believe. What year was that, and did it improve their lot?
Yeah, that was James at March 71? May 71. So they left in May, and then the asylum opened in October. It didn't change the circumstances for the girls. They were worse on an island. It was, the Newcastle did give that like an island effect, because the way they were ostracised by the community, the way they were treated, they had such a bad name that half the townspeople went to the wharf to wave them off. They were happy to see them gone. But Cockatoo Island, I think things probably got worse because they were out of view from...
Is that where they went?
Yeah.
In a sense, it seems to me you're working at something that's quite counterintuitive, which is the notion that the government, through necessity, develops sort of a plan to care. It develops into an interventionist kind of state that's concerned with the welfare of its citizens. To me, that doesn't sit very neatly with the idea of necessity and serendipity, and we have this problem and we need to solve it, and the whole notion that it's a very ad hoc kind of development. So I'd like to compare that with the sort of parallel you drew at the end with the intervention to smoking and cigarette packets and such. Do you think this is genuinely an interventionist state with a real ethic of care that's trying to put in place, or it's merely a colonial government trying to deal with problems?
I was sceptical, mainly because you hear people today complaining about our health system, about policies, about this, about that, and looking at the care of the girls as an example, there were good intentions. The government had very good intentions at trying to care for these kids that were on the streets in Sydney. There was a big problem. So I'm probably not as cynical in thinking, like, yeah, I just think that they could see that the need was there, that they did put in place a lot of these other sort of institutions and that.
So it's an interesting finding. Yeah. I see that one. Yeah, you bore that out, I think. Paper. Are there other?
Can I just add to that? I think because I still work as a social worker today, I can see the problems in mental health and for homeless children, and I think that's what struck me with Parks, putting a roof over their children's head in an institution, which we might not think is ideal today, but I think it was quite revolutionary considering that there wasn't a lot of other sort of non-charitable organisations that were really there as much as they were in Britain.
So not just concerned with social control, which is often what we see in the, in the remnants. That's what we can understand. But in fact, also sort of social rehabilitation in terms of people living better quality lives. That sort of caring at that level in terms of trying to help, which
encouraging them to have servants and getting work.
Right. Yeah. Greg, do you?
Yes.
Yeah.
I was just interested, really hearing about the moral therapy, which is really interesting, and having those gardens and having the community coming in and using the gardens while the inmates themselves were the gardeners. Now, I'd be interested, what were the interactions? And it's lovely hearing about these overseas visitors coming and games of skittles being played.
Yeah.
I mean, I've had an interesting experience myself. We had friends from Hong Kong, and I took them in to see the hospital and the grounds because they're so historic. And as we were there, one of the patients came up and gave this Chinese friend, an older lady, a kiss on the cheek. So that was a talking point. So I wonder if things like that might have transpired in the past.
Well, and I think that's what I try to draw out, that for most of the 20th century there was that closing of the asylum and that with medical treatment people went into it, so the care was within the buildings. There's not even a lot of photographs of the site in the 1900s. There's the ones taken by Ralph Snowball. But because we've got that real privacy thing happening and mental health, the stigma of mental health, and it's completely different to a general hospital that people would freely walk in. This particular site, people would deliberately gaze the other way or not feel as if they're trespassing if they walk in. But there were some interesting little antidotes that did happen when the community were using the site. For instance, there was the town's engineer who made a balloon. It was like this whole event that people could meet at the site to watch this balloon being launched, and people in the houses with telescopes. And the first one blew up, it caught on fire, so that's quite a spectacle. But the second one was successful. But the newspaper article describes it beautifully, that it did bring people into a certain point, but then there are other people in the city that could sort of see it was actually legal from where it went to. So
I'd like to just follow on, actually, if you don't mind, with the question about what you think the motivations there were for community engagement. I mean, there's such a long history. In Renaissance Venice, the convents would have beautiful singing, and the nuns would sing, and international visitors would come from everywhere to hear this beautiful singing. And so the institution had a real place in the fabric of society. I mean, I think these institutions, and then in London in the 18th century, we've got George Frederick Handel, composing for the Foundling Hospital, and it becomes this great society place for people to gather and meet. And I mean, often it was to attract private support, including financial. But also here it looks like there's a kind of a community engagement to keep it running on the site. They have to be good to the neighbours. Is there that as well? I mean, what?
Yeah, there could have been. This Frederick Kane, who was the superintendent for well over 10 years, maybe 15 years, and he was a musician himself. His family, he encouraged bands to play regularly. I don't know whether it was. I'd like to find out more about his background and whether he was a Quaker, perhaps. Like he seems to not come from like any religious background, but he definitely encouraged the community into the site. And
did they attract funds?
No, so that's where it's different to the British ones. And I looked into that, but the whole idea of having an ornate asylum was to attract people to come to visit, and then have subscribers so that would fund the institutions. Because these ones were government ones, they didn't need that support. So it was really perhaps.
They had space and they had labour as well, I suppose. So they just almost despite themselves. They create a special space because they've got free labour and they've got the space to do it.
And because the site was used by the community as a recreational ground too.
Right,
so it's probably,
lots of interesting things, and hopefully we can continue asking Anne some questions. We might wrap up the formal part, but we'll have a cup of tea and coffee just around here, and maybe we can keep asking Anne some questions. But please join me in